The patient is a 50-year-old female that underwent a total abdominal hysterectomy and is post-op day 1. The patient has rated her pain 9 out of 10. The student nurse has done her 2 medication checks for scheduled Ketorolac and ready to case present her medication to her instructor.
Ketorolac, branding Toradol, is an NSAID and a non-opioid analgesic. Pregnancy category C prior to 30 weeks gestation, D starting at 30 weeks gestation. Chronic use in third trimester may cause constriction of ductus arteriosus, may inhibit labor and increase maternal bleeding at delivery. Do not breastfeed while on this medication. It's used for short-term management of acute, moderate to severe pain. Provides analgesia at an opioid level, usually used in the post-op setting. Action of this drug includes that it inhibits prostaglandin synthesis, producing peripherally mediated analgesia. Also has antipyretic and anti-inflammatory properties. Therapeutic effects includes decreased pain. Contraindications include hypersensitivity, cross-sensitivity with other NSAIDs, preoperative use, active or history of PUD or GI bleeding, coronary artery bypass graft surgery, cerebrovascular bleeding, advanced renal impairment or at risk for renal failure due to volume depletion, concurrent use of pentocephylline or probenecid. Precautions include cardiovascular disease or risk factors for cardiovascular disease, recent MI or heart failure, coagulation disorders, mild to moderate renal impairment, hepatic impairment. Safety is not established in neonates. The geriatric population has a potential of increased bleeding. Some side effects include GI experience such as abdominal pain, flatulence, perforation, stomatitis, nausea, vomiting, diarrhea, constipation, GI fullness, heartburn, dyspepsia, GI ulcers. Other side effects include abnormal renal function, drowsiness, headache, Stevens-Johnson syndrome, toxic epidermal necrolysis, anemia, edema, hypertension, pruritus, tinnitus, dizziness, increased liver enzymes, increased bleeding time, purpura, and sweating. Drug interactions include probenecid, pentocephylline, aspirin, NSAIDs, potassium supplements, corticosteroids, alcohol, diuretics, antihypertensives, lithium, methotrexate, anticoagulants, clopidogrel, corticosteroids, fibrinolytics, SNRIs, SSRIs, antineoplastic medications, radiation therapy, cyclosporine. Natural products that increase the risk of bleeding include arnica, chamomile, clove, dong quai, feverfew, garlic, ginger, ginkgo, panax, ginseng.
Patients with asthma, nasal polyps, or aspirin-induced asthma are at increased risk for hypersensitivity reactions. Monitor BP during therapy. Assess pain prior to and 1 to 2 hours following therapy. Monitor liver function tests and bleeding time. May increase BUN, creatinine, or potassium concentrations. Do not confuse Toradol with tramadol. Administer in higher than recommended doses does not increase the effectiveness, but may cause increased side effects. Co-administration with opioid analgesics may have an additive analgesic effect and may permit lower opioid doses. Give initially as IM IV route. Use PO therapy only as continuation of parenteral therapy.
The patient has been started on PO Ketorolac. She has been given 20 mg by mouth initially, followed by 10 mg every 4 to 6 hours, not to exceed 40 mg per day. Patient education includes how and when to ask for and take pain medications. Do not take longer than prescribed or longer than 5 days. Drowsiness, dizziness may be evident. Avoid activities that require alertness until response to med is known. Avoid concurrent use of alcohol, aspirin, NSAIDs, acetaminophen, or other over-the-counter medications unless consulted with healthcare provider. Advise healthcare provider on medication regimen prior to surgery. Advise the patient to call the doctor if they notice any rash, itching, visual disturbances, tinnitus, weight gain, edema, black stools, persistent headache, flu-like symptoms such as chills, fever, muscle aches, or pain. Advise female patients to notify healthcare provider if pregnancy is planned or suspected or if breastfeeding. Evaluation of medication effectiveness includes decrease in severity of pain. Patients who do not respond to one NSAID may respond to another.